A very good evening to one and all of you present here. I am Dr. Praisy Joy from AIMS Bhubaneswar, and I am going to present my poster Achondrogenesis 1A, a rare lethal type of skeletal dysplasia. Introduction. Skeletal dysplasias are a heritable group of disorders that affect bone and cartilage. They have significant effect on muscle, tendons, and ligaments. Here, we present a case of achondrogenesis type 1A. Achondrogenesis type 1A is an ultra-rare type of skeletal dysplasia with an incidence of 1 in 40,000 live births due to mutation in TRP11 gene. This disorder has a varied presentation described in literature, which includes short thorax, defective formation of long bone, skull, and vertebral anomalies. Achondrogenesis type 1A is a severe chondrodystrophy. It is classified into type 1 and type 2. Further, type 1 is divided into type 1A and 1B. The thyroid hormone receptor interactor 11, also known as Golgi-associated microtubule binding protein 210, that is GMAP210, plays essential role during skeletal differentiation and development. Going on to the clinical history, a 35-year-old female, a preemie, non-consanguineously married, presented to a perinatal clinic with a first pregnancy scan showing multiple congenital anomalies and was terminated at 19 weeks of gestation. The anomaly scan showed sacral agenesis, narrow thorax, vertebral flaring, small bones of the upper and lower limbs, hypoplastic forelimbs and hind limbs with very short femotibia, fibula, and humerus, and distorted alignment of spine, all suggestive of skeletal dysplasia. Then she was evaluated for carrier status of pathogenic variations. This is a pedigree of the family showing that the couple was non-consanguineously married and this was their first pregnancy. This is an image, post-abortal image of the fetus after MTP, which showed anteverted nares, low set ears, short neck, narrow thorax, and severe micromelia. Whole exome sequencing revealed a heterozygous variant in the female, and Sanger sequencing showed the same variation in the husband as well. So, coming on to the report, it was a heterozygous 13 base pair deletion in exon 13 of TRP11 gene that resulted in frame shift termination and premature truncation of protein 15 amino acids downstream to codon 511591, and it has not been previously reported in 1000 genome and 1000 genome and internal databases. In silico predictions is damaging by mutation taster 2 and it is conserved across the species. This is the Sanger sequencing report of the husband, which showed the heterovariant in TRP11 gene. Going on to the discussion, Golgins are a family of coil proteins associated with Golgi apparatus necessary for tethering events in membrane fusion and as structural supports for Golgi cisternae. GMAP210 belongs to this Golgin family and localizes to the cis Golgi network. It is involved in microtubule binding and serves as a tethering factor required for endoplasmic reticulum to Golgi vesicle transport in early secretory pathway. Going on to the genetic counseling, the 25% risk in every pregnancy and the need for prenatal diagnosis in the subsequent pregnancies was explained to the couple. Various options like prenatal diagnosis, pre-implantation diagnosis, and adoption was also explained to the couple. These are my references. Thank you so much for your time and patient listening. Thank you.